In the fourth section now we will talk about the antenatal care of the multiple pregnancies. In the antenatal care especially, we will talk about what are the different screening tests performed for the antenatal care of the pregnancy, and then anomaly scan, and then the different types of fetal growth assessments that can be performed with the twin pregnancies or multiple pregnancy. So antenatal care is very important for even the single pregnancy, but when it's multiple pregnancy or twin pregnancy, it's even more important that we should have a routine antenatal care, and antenatal appointments should be regularly followed, and to find out the condition of the fetuses, and if they are growing normally, or what's the fetal well-being assessment. So that should be routinely performed. So antenatal appointments should be followed, and then screening for hypertension and gestational diabetes. The chance of getting high blood pressure and diabetes during twin pregnancies is a lot more common as compared to single pregnancy. So routine screening for hypertension, regular monitoring of blood pressure. Even the females with twin pregnancies, they should be trained to take their blood pressures at home also, because they cannot come to the hospital all the time for checkup of the blood pressures, and they should monitor their blood glucose level at home also with the glucometer, because there are higher chances of getting hypertension and diabetes with twin pregnancy, and both can, especially they can cause serious implications on the mother and the baby. So screening for hypertension and diabetes. Antepartum hemorrhage and thromboembolic diseases. Again, hemorrhage should be prevented. Anything that can lead to hemorrhage should be avoided. Any injuries, laceration, tears, that should be avoided. And then thromboembolic disease can also occur, because mobilities is important. Women with twin pregnancies, they should walk regularly, and they should not stay in the bed for long, and should not sit for a long period, because that can lead to thromboembolism also. So these are few very important steps and to take in the multiple pregnancies. Next, screening in multiple pregnancies. Screening is usually performed to accurately date the pregnancy. Gestational age is important to find out, because the growth of the abdomen is faster than the single pregnancy, more rapidly. So screening for exact gestational age is important. That can be done with the ultrasound and different assessment measurements like biparietal diameters, abdominal circumference, and then femur lengths. They are measured regularly to find out the exact normal gestational age. Crown rump length is the one way of measuring the gestational age. Then to determine chorionicity for screening should be done to find out if it's monochorionic or is dichorionic. That's usually done by lambda or T sign, and then membrane thickness. To screen for Down syndrome, and to assess for transfusion syndrome. And then for assessing that, usually we have A wave in the ductus venosus. A wave in ductus venosus at 11 to 13 weeks of gestation is useful to assess transfusion syndrome. So these are all different screening tests done in the multiple pregnancy to assess number of placenta, to rule out if there is any transfusion syndrome occurring, to rule out the Down syndrome and the normal gestational age. Anomaly scans are performed to find out any congenital anomalies like any Down syndrome, any other chromosomal abnormalities that can occur, any structural abnormalities, any structural defects in the fetuses. This is the conjoined twin. They are joined together. Surgeries can be performed to separate the conjoined twins if they have usually one can be saved, and the structures and organs that are joined together, surgeries can be performed to fix them. So these type of anomalies can be detected by doing different anomaly scan. Structural defects in the different organs of the body, in the heart, in the brain, in the respiratory system, in the spinal cord, all that can be detected by doing these scans. Anencephaly is also another condition that can be detected by doing anomaly scans in which the size of the head is small and it's anencephalic. So for the routine assessment of the twin pregnancy, the growth assessment is very important. How we should do the growth assessment, usually we do it by the measurement of the head circumference, then we do it by the abdominal circumference, and also by the measurement of the femur length. All these are important steps for the assessment of the growth of the fetus. Then the assessment of the regular well-being of the fetus is important, especially in case of twin pregnancies, because in twin pregnancies usually one fetus is growth is restricted and the other is normal and healthy. Both fetuses might be growth is restricted, or both can be totally normal. So it's important that we should assess the growth of the fetus. Normal measurements should be taken routinely with the help of the ultrasound, and then a biophysical profile should be done, and that's the non-stress test is done, in which the effect of uterine contractions are assessed on the fetus, if the heart rate is accelerated, if the breathing is affected, how many movements of the fetus they are recorded with the in a certain time period. So this is important for the routine physical to find out the well-being of the baby, and if this ultimately affects how we can plan the delivery of the twin pregnancy, and then how we can manage it prenatally and postnatally to avoid any complications that can occur. So that was all about section 4. Thank you for watching sqadia.com.